This is the recording for the Occupational English test, and the test is held at Medcity International Academy, Kannur on 25th May 2023. The candidate's name is Vaishnav and the candidate number is 1001002. The interlocutor is Ashreya and the interlocutor number is 57468. This is role play number 1 for the profession of nursing. Good morning.
Good morning.
May I see your identification, please? Thank you. This is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally. We will move on to a warm-up session to get you started. This is not in any way assessed. Could you please introduce yourself?
Sure. I'm Vaishnav. I'm from Kannur and I have completed my BSc Nursing from Yanapa University, Bangalore. And for the last 1 year, I was working in Astramims Kannur in the emergency department as a registered nurse. That's about myself.
Okay. So what do you think are the qualities that a nurse should possess?
Thanks for the question. According to me, I think there are some qualities that a nurse should possess, like they should be very punctual in their work and they should show more empathy towards the patient and they should be always a good observer in the work scenarios.
Okay. Do you have a role model?
Actually, I don't have any role model. I get inspired from the people around me and I improve myself.
Okay, so that's the end of your warm-up session.
Thank you.
Let's move on to the role play now. I'll be taking the part of the patient and you take the professional role. The role play will last a total of 5 minutes and you will be given 3 minutes to prepare for the same. The role play intends to get evidence of your ability to perform effective communication with patients. Do you have any questions?
No, ma'am.
So you will have 3 minutes to prepare your role card. You can make notes on the role play card if you wish to do so. And here is the pencil and your role play card. So you can look at the card during the test, but must return it to me at the end.
Sure.
And your role play preparation time starts now. Okay, so that will be the end of your preparation time. The role play will last for 5 minutes. Don't worry if I stop you when the time is up, and you can begin now.
Good morning.
Good morning.
I am Vaishnav, the registered nurse working in this community health center. How may I address you?
You may call me John.
Okay, Mr. John, may I know the reason for today's visit?
Yeah, nurse, actually I got a leg ulcer and it is not going away. So I'd like to ask what are the causes of leg ulcers?
Okay, Mr. John, I understood your concern that you are having a leg ulcer, isn't it?
Yes.
So I'll be telling about some of the causes of getting a leg ulcer. So the first thing is poor circulation. Like if our body parts are not getting proper amount of blood, the chances of getting a leg ulcer is very much high. Secondly, the patient with a diabetes, like the diabetes patients are very much prone to getting a leg ulcer, as I can say. And third one is any kind of trauma, like if you're getting any injury through a cut or from a burn, and that injury is not treated properly, the chance of getting a ulcer is very much high, as I can say. So from the above mentioned causes, what might be your cause for the injury, as I can say?
Yeah, I think I understood what might have caused the leg ulcer for me. I got a pretty deep cut while I was gardening a few weeks ago.
Oh. So I think that might be the cause for your injury and the ulcer you got. So is there any other concerns you got, Mr. John?
Yeah, I do have a concern. So I would like to ask if I need to take any antibiotics for the leg ulcers.
Okay, I understand your concern that you know something about the antibiotics. That's what I think. And I would like to say that in your case, there is no need of any antibiotics because antibiotics is only prescribed by the doctor if the wound is getting infected. Only for the infected wound, the antibiotics will be the prescribed one. And in your case, it is a very small wound, so there is no need of using antibiotics in it. Am I clear?
Yes.
Okay, Mr. John, is there any other questions you got?
Yeah. So my friend, he had a leg ulcer and had to get a skin grafting. So will I need one too?
I understand your concern and you know something about the skin grafting, isn't it?
Medcity OET app. Learn OET listening, reading, writing, speaking, and OET related grammar at your own convenience. Download the app now.
Yeah, the thing is that skin grafting is only prescribed for the patients whose ulcers are very much severe, like they're having a very huge wound. So only for those cases, only the skin grafting will be the recommended one. In your case, it is very a small ulcer and it can be treated through a proper cleaning methods and proper dressing. Am I clear?
Yes.
So you know not be needing any kind of skin grafting, as I can say. Am I clear on that?
Yeah, that's clear.
Okay, Mr. John, is there other thing you need to be clarified about?
Yeah. So what are the precautions I might have to take to prevent worsening of ulcer?
Okay, that's a very good question from you. I really appreciate that you are ready to know about the preventive measures, isn't it?
Yeah.
So I'm here to help you. Don't need to be worried about that. I'll be explaining in detail. So first and the immediate thing you should do is that you should clean the ulcer properly. Like cleanliness is one of the very important thing, and you have to keep it dry. So doing that, you can just prevent the further get infection of the ulcer, as I can say. And second one is you can always elevate your infected leg. So it is to prevent the further swelling on that area, and it will also give you a proper comfort for you. Okay, am I clear on that?
Yeah, that's clear.
So there are some more things that you can do to prevent these ulcers getting severe, like you can use a compression stocking. So due to that pressure, will be a good blood flow to that infected part. It will be helping the easy healing. And there are some lifestyle habits you need to be just concerned about, like you should avoid smoking if you're one person who is used to smoke. And other thing is that you should always maintain a healthy diet. Like healthy diet is very much important in the prevention and from the getting recover from the ulcer. Like if there is a not even good amount of protein in our diet, so it will be affecting the recovery time. So proper and a balanced diet is very much important in getting prevented from the ulcers, as I can say. Am I clear on that?
Yes, that's clear.
Okay, Mr. John, is there any other thing that I need to be clarified about?
No, nurse, everything is clear, and I'll do make sure that I follow all the instructions you have given me.
So I really appreciate that, Mr. John, because you're ready to follow my instructions, and I assure you that if you are doing all these things, you will be getting cured in a very short time. So you don't need to be worried about. You are in the best place. So we are here with the best facilities and the treatment options. We'll be just providing with the best treatment we got. Am I clear?
Yes, nurse, that's clear.
Okay, Mr. John, is there any other concern?
No.
So you may rest now. Thank you.
Okay, thank you. So, okay, that marks the end of your speaking test. So please return the role play card to me. Thank you.
Medcity International Academy. Trusted hands forever.